And then next presenter is Dr. Nivisha. She is presenting long-term outcome of type 1 keratoprosthesis, Boston, Lucia, and Oro.
Good morning, everyone. My name is Dr. Nivisha, and I would be presenting a paper on long-term outcomes of type 1 keratoprosthesis, Boston, Lucia, and Oro. We have no financial interests. So as we all know, type 1 keratoprosthesis is used in end-stage ocular surface disorders and eyes which have failed conventional corneal transplants. We have three types which are available as of today. Boston type 1, which is the prototype, followed by Lucia and Oro, which were built on the similar design. The aim of the study was to analyze the long-term outcomes of type 1 keratoprosthesis in a tertiary eye care center over a period of 14 years. It was a retrospective interventional case series done on 87 eyes from the duration of January 2008 to 2022. Medical charts were reviewed to analyze the anatomical and the functional outcomes. The anatomical success was defined as a K-Pro retained in the eyes till the last follow-up without extrusion, evisceration, explantation, or an exchange of the device. Functional success was defined as a BCVA achieved of more than 6/60 vision in the post-operative period, which is the limit for legal blindness in India. The study included 87 eyes of 86 patients, which underwent a total of 104 K-Pros, including 17 re-K-Pros or secondary K-Pros done for various indications. The indications of the K-Pros in our study were majorly silicone oil-induced keratopathy and chemical injuries, each of which comprised of 40% of the cases in our study. We had a long duration of follow-up with a mean of 5.5 years and a range with a maximum of 14 years of follow-up. 48% of the patients had more than 5 years of follow-up in our study. Now, coming to the anatomical outcome, 59 out of 87 K-Pros were retained at the last follow-up, giving an anatomical success rate of 67%, as you can see in the chart. A Kaplan-Meier survival analysis was done. As we can see on the graph and in the chart, the 5-year survival rate was comparable amongst the three groups, that is Boston, Oro, and Lucia, with an overall survival of 80% at the 5 years post-op period. Coming to the functional outcome, visual acuity of more than 6/60 was achieved in 61 eyes, giving a functional success rate of 70%. 31 out of these 61 eyes maintained the good vision at the last follow-up. The Kaplan-Meier graph shows that the probability of achieving functional success at 5 years was comparable in the three groups of Boston, Oro, and Lucia, with an overall probability of 66% of functional success. An indication-wise analysis was also done. As you can see in the Kaplan-Meier chart, that is the first chart, the anatomical outcome of silicone oil-induced keratopathy showed a better anatomical success as compared to the others. So the 5 years survival rate at 5 years was 89% for silicone oil-induced keratopathy and 75% at 10 years as compared to approximately 30 and 40% at 10 years for the other indications. On the other hand, the visual outcome for all the indications was found to be comparable in our study, but this data was not statistically significant. The anatomical outcome was statistically significant though. We encountered multiple complications in our study, retroprosthetic membrane being the most common, seen in 60% of our cases, followed by perioptic melt and leak. Endophthalmitis was seen in 6 eyes in our study. These complications were managed either surgically or medically. Anatomical failure due to infection, including with or without endophthalmitis, perioptic melts not resolving with repeated lamellar keratoplasties or extrusion, necessitated a need for a secondary K-Pro implantation. Perioptic melts was the most common cause for secondary K-Pro implantation in our study. Out of the 87 K-Pros implanted, 59 K-Pros were retained at the last follow-up, giving a primary success rate of 67% in our study. The 17 eyes underwent a secondary keratoprosthesis, 13 out of which were retained at the last follow-up, giving an improved anatomical success rate of 82%. The retrospective nature was the only limitation of our study. In comparison with the previous studies on the similar lines, our study had a long duration of follow-up with a mean of 4.9 years, which was more than that of the previous studies. The visual outcome and the primary device retention rate was comparable with the previous studies. This was the first study wherein the outcomes of the 3 K-pros which are available as of today was compared. In conclusion, this study highlights the anatomical and functional success rates of the 3 kinds of K-pros available today, and it was found that the outcomes are comparable. It also noted that the anatomical prognosis was better in silicone oil-filled eyes than that for chemical injuries. Therefore, when affordability or availability is a limiting factor, Oro K-pro or Lucia K-pro can be considered as an alternative to Boston K-pro. These were my references. Thank you.